The annual winter respiratory virus season is back in full swing and is here with a vengeance. New Jersey medical centers are seeing a significant uptick in people catching the flu, RSV, and COVID-19. In fact, the CDC ranks New Jersey as among the highest in the nation for flu activity. And according to weekly surveillance data from the State Department of Health, about 5% of all emergency department visits due to respiratory illness during the first week of January were attributed to the flu. Health experts say most cases are relatively mild, but they're still highly contagious. Dr. Suraj Sagar, chief of infectious disease at the Holy Name Medical Center, has tips on how you can stay healthy this season. He joins me now. Thanks so much for giving us some of your time. Let's talk first, Doctor, about which respiratory viruses are most prevalent this year and how that compares with last winter.
Sure. So like a lot of winters, especially pre-pandemic, we're seeing a rise in influenza A, RSV, COVID-19, as well as other viruses like parainfluenza, human metapneumovirus, and what we call the non-novel coronaviruses, i.e. the common every year seasonal version of coronavirus. So there's a whole host of viruses out there. We are much better able to be detecting these viruses. And so now we have much better data in terms of their incidence, their prevalence. And certainly, to summarize, we're right in the middle of the flu and cold season.
So you mentioned COVID. Where do we stand there? Are we seeing an increase in cases, or are respiratory illnesses like flu really taking center stage?
Yeah, I would say that COVID is in third place right now. It's really RSV and influenza that are leading. We are seeing an increase in COVID after a very slow start. What I would say is that we are seeing typical influenza and RSV like we have in other years. COVID-19, as you remember, kind of lasts throughout the year. So I would say that what we're seeing here in New Jersey is mirroring the rest of the United States. COVID-19, slow to start, now starting to take off, may very well peak a little bit later than RSV and influenza, which are certainly in the lead right now.
Are there any new mutations or strains, Doctor, that we should be concerned about, or that you all and your team are worried about for this season?
No, we call it genotype. We look at the specific strains of different viruses. And what I will say is that for COVID-19, the main strains still remain, you can say, descendants of the Omicron virus. And so while, yes, there are certain small mutations that make a differentiation in the names of these viruses and the strains, the current medications, the current vaccines, the vaccine boosters are all effective at preventing severe to critical disease. And so no, the strains, while they are interesting from an academic point of view, thankfully they're not conferring any increased transmissibility, so it's not more infectious, nor are they seeing any more virulence, meaning they're not causing any more severe disease than strains we've seen in the past.
I'm thinking too just about public health measures. Has your hospital reinstated, things like masking or even distancing to the extent that you can? And are those measures that have largely been, forgotten now?
So they're never forgotten. I mean, our own institution, the Holy Name in Teaneck, the safety of our patients and especially the most vulnerable patient populations is paramount. What we do is utilize very specific and targeted isolation practices. So we look at the patient, we look at their host factors, what diseases they might have, and then we institute specific precautions for that patient and for that situation. So while we don't have a universal mask mandate, we are very astute in monitoring our caseload of not just COVID-19, of RSV, of parainfluenza, of all the different viruses, bacteria, et cetera. And then we intervene early if needed based upon that data.
Let me ask you very quickly before we have to go, what can we do? I mean, of course, hand washing, but people always want to know, how can I prevent myself from getting the flu or COVID or RSV this year?
So I'm glad you said that, because people are looking for very high-tech solutions. It comes down to hand washing, or we call hand hygiene, highly effective, extremely effective. And you'd be surprised how many people kind of forget and don't always wash their hands, maybe after the bathroom. But, if they touch elevator buttons, they may be in the mall, touching different surfaces. You really want to wash your hands regularly throughout the day. You want to avoid touching your face, which the average person does 5 to 7 times a minute. They don't realize it. I'm guilty of it as well. And of course, you want to make sure that you are fully vaccinated based upon your individual risk factors, your age. And so seasonal influenza, RSV, COVID-19 boosters are all available. I implore everyone to talk to a healthcare provider, making sure that you're getting the best information so you can make the most informed decision for you and your family.
That's good advice. Dr. Segar is the chief of the Department for Infectious Disease at Holy Name. Thank you so much.
Thanks so much for having me.